Lininger. Today I'm going to tell you a little bit about carpal tunnel and chiropractic. Now, the problem with carpal tunnel is it's become a wastebasket diagnosis, even for doctors. That means that basically when doctors hear wrist pain or hand pain, they automatically write down carpal tunnel syndrome and bill it off to an insurance company. So because that's what they think it is, and that they don't do any more research to see if it's really carpal tunnel a lot of times. They just label it wrist pain, carpal tunnel, and that's probably a little bit of a shortcut to thinking. And I see this with specialists too. So real true carpal tunnel is compression of the median nerve at the wrist here that goes into the fingers. There is no pain, numbness, or tingling above the wrist in true carpal tunnel. So the chances of you having compression of the median nerve, which is a nerve going through the carpal tunnel into the hand, and sometimes it calcifies and gets compressed, the chances of that happening at the same time in your life in both hands, the right and the left, is very, very minimal. And yet I consistently see consults with patients in my office that have been diagnosed by another doctor with carpal tunnel syndrome in both hands. And way too many times do I see it for that to be actually true carpal tunnel. So a lot of times I'll ask them, in addition to the pain you're having in the arms, well, I always ask them, in addition to the pain you have going to the wrist and the hands, or numbness and tingling, do you also have symptoms above the wrist? And they'll say, yeah, I'm having it both my arms, the whole thing is numb, I get pain shooting down my arm, and that's not carpal tunnel. That's something called radiculopathy, which is coming from the nerve root, which lies up here in the neck. So it's much more common for a patient who has bilateral or both arm symptoms not to have carpal tunnel, but to have radiculopathy. And that means we got to look up here in the neck for the cause of the condition. So a lot of times if the nerve root is pinched here, they'll get bilateral symptoms going down the arms that include, but are not limited to, the wrist and hand. Okay, and it could be misdiagnosed with carpal tunnel if the doctor doesn't ask enough questions, and a lot of times that happens. In fact, I've even seen patients that have had operations on their wrist and they sew it back up, and 6 months later the patient still has the symptom, and it's because the problem was never here. It wasn't really carpal tunnel, it was radiculopathy coming from the neck going down the arm. And unfortunately, I've seen patients that even have both wrists that have been operated on, sewed back up, and they're still having the symptom. It's because they didn't really have carpal tunnel to begin with, and they were treated as if they did. So it's a really good idea if you're having especially bilateral symptoms of wrist pain or hand pain, to get checked not only here at the wrist, but to be checked by a chiropractor, take an x-ray here of the neck to determine whether or not the nerve root itself is being compressed or irritated or inflamed. And that's where chiropractic can help carpal tunnel, is because if it is, not only can we adjust the wrist here at the joint itself and mobilize a true carpal tunnel, but we can also treat the neck to unpinch the nerve up here and prevent or reverse the damaging effects of true radiculopathy, which is affecting the entire nerve, not just the nerve from the wrist to the hand. I'm Dr. Lininger. Have a nice day, and I'll see you on the next video.